should be recording.
Okay.
Hopefully working. Yep.
I can see a little red symbol, so I'm assuming it is.
Yep.
Okay. Well, morning everyone. My name is Derek Lamb, and our company is Pushmybutton, and we are the resellers for Happy or Not throughout Australia and New Zealand. So we've been working with the PHA or the individual PHNs for a while now. We work with other PHNs in Australia, and then in New Zealand they refer to them as PHOs, I think, similar types of organisations. So we're based in Auckland, New Zealand, but we used to travel to Australia quite a bit. We're doing everything remotely at the moment, and then the product itself, Happy or Not, is from Finland. So if you have ever sent a email to support at Happy or Not or anything like that, that'll be the Finnish team that's responding to you. So the idea of today is to take you through just a bit about the service. So I don't know how many on the call have had a lot to do with it, or even were involved in the presentation that I probably did a couple of years ago, but I am going to sort of start at the start to make sure everyone's got sort of the fundamentals. If any of it is a bit basic and you want me to move along, please do. Happy to. If you have a question, you can either just obviously unmute yourself and ask it, or you can pop it in the chat window. Or if it's not something you want to ask to the group, you can, I'll provide my contact details at the end of this session. Okay, so a bit about the service. So basically the idea of what we're doing is providing a service really that is designed for the practice to take on and manage their patient satisfaction measuring themselves. So while this group on the call is obviously supporting multiple practices, really the idea is that we're putting the devices into the practices, providing them the reporting. They are the ones that will obviously make the change at the front line. But as far as this group, you can obviously see how each of the practices are going. You can see how your group of practices is going, and really, I guess, trying to, support the practices in improving their patient experience. So the service itself, I guess, is fully contained or self-contained. So there's nothing that I guess the practice needs to provide, or even the individual PHNs need to provide. So we have the feedback collecting smileys, and so that is obviously the physical device in the practice, as well as we have some digital capability, which I'll talk about, that will collect feedbacks from patients, and that will send the results to our reporting service that is cloud-based, and people can access either through the reports they get weekly and monthly. They can log on to our reporting system to view them, or they can access it through their phone on an app as well. Okay. So the devices we've put into the practices are called our Smiley Touch. They are a tablet-based device. Really, the only thing the devices are designed for is for capturing feedback from the patients. Okay, so there's nothing that people can do on the device as far as changing questions and all that. That's done through the back end and the reporting portal. Okay, just a quick sort of overview of how it works for those of you that haven't seen it, or a refresher for those who have. Our service is based on asking someone a single question. So we'll ask them a single question at any one time. We can change that question over time, and we have. But as an example, please rate our service today, and someone one of the faces to show their satisfaction with that question. We then prompt them with a follow-up, which they are able to give you some further details as to why. And then the third level is the open feedback. Okay, so that open feedback, they can type a comment into the system. So the reason for a single question on any one time is that basically you'll lose sort of 50% of people giving feedback with each additional question you offer. So in this example with the 3 levels, we talk to people about an aim of 20% of people giving feedback, so 1 in 5. And that's quite achievable for practice, I would expect. So if you are having a discussion with the practices, and especially new practices, that would be the first I guess, KPI that we'll be looking for. They would obviously have an understanding of how many patients they see in a day. So it's just dividing that number by 5 to give them a bit of a aim of where they can be. Every practice is going to be different, and I realize that, but there's a good starting point. And we'll talk a bit more about how we drive the practices a bit themselves. Just some quick tips and tricks about the devices themselves. So the devices are designed to be plugged in at all times. Okay, with the device there should be a power cord and a charger. The charger looks like a phone charger, but it's slightly different than a phone charger because a tablet requires slightly more power. Okay, we have had a couple of instances where someone's lost the charger or something like that, and they've tried to use a phone charger. And generally the giveaway will be that the device doesn't operate like it should. It might turn off and on, it might go black. So the first things to check when those types of things are happening is the power. Okay, so just make sure that they've got the original cables and the original charger. And the other thing we've seen is where it's perfectly fine to put it into a multi box, with multi plugs. But if there's a couple of really power hungry other things plugged into that multi box, the device might not get enough power. So that's another thing to check if it is plugged into a multi box, or if that is a problem, it may need to be plugged directly into the wall. Okay. There will be instances where maybe a practice just doesn't have a power cord in a convenient location. So they don't want to run a power cord for tripping or something like that. The device itself will last for 6 to 8 hours without, being unplugged. So there are some instances where a site may need to charge the device overnight and then put it out through the day. But it will only last 6 to 8 hours, and that's probably not going to give most practices a full day of responses, but maybe that length of time is better than nothing. So generally the devices come ready to go. So they use the Optus or Vodafone network. I think we had one site for the PHA that didn't have that. So we do have we can turn it on to Wi-Fi if necessary. Okay, so if we take it to a new site and it's not connecting, we can just change it to Wi-Fi. And so I have the capability to help you with that. All of the survey settings and all that sort of stuff are done in the reporting survey. Generally, the way it works is so Kim, obviously working with the team, will sort of work out what the next question is going to be, and that will generally be done ahead of time. And most likely it's going to start on the 1st of a month. So generally, those questions will be set to run for 2 to 3 months. And we'll set up that question ahead of time so that on the day it's going to change, the device will just simply change onto that new question. So really all that needs to be done is just communicate it out to this group and the practices that, hey, starting on the 1st of November, we're going to have a slightly different question and it's going to have these types of follow-ups. Okay. The follow-ups, so in that video before, the follow-ups are those reasons why people tell you why they had a good or bad experience. Okay, so generally we have 5 follow-ups. So that's, giving people the option of why they had a good or bad experience. And so what that means is the second screen will stay there for up to about 10 to 12 seconds. Okay, so when you select a face to show your satisfaction with the question, you will get the follow-up options. People can just walk away from the device at that point. They don't need to give a follow-up for us to count their first response, okay? But if they want to give a response, they'll have about 10 to 12 seconds before the device will time out and go back to the front screen. We do now have the option to slow that down slightly more. We have had a couple of locations where they just said, look, the demographics for our practice just require a little longer. We can do that site by site if necessary, okay? The open feedback, so that's the third level of the comments that people can put in. So generally, that provides a lot of use. You will sometimes find that someone can write something that's not very nice. It may be some bad language, or it may be just something personal about someone. Our system will filter automatically spam, a message that it deems as spam. That's things that aren't written in proper English, where there's a lot of emojis or just sort of rubbish. What can get through our spam filter is something that's written in perfect English that's not very nice. There is the ability for the admins to manually flag a message as spam, saying we don't need to see this. Okay, so that is possible. So if you just see something in there you want to get rid of, you will most likely have the ability to flag that as spam. If not, you can check with Kim and we can resolve that for you. Okay. We do have multi-language capability, but we haven't had any requirement for that so far. If there was a practice that had, you know, a really high demographic where English was not the first language and they wanted that capability, we can do that for an individual site as well. So one of the things that we introduced during COVID, while you know, perhaps touching a device was not something people wanted to do, was what we called our Smiley Link. What this is just a digital way of people providing feedback. There's two ways that this can work. So one of the ways is that the practice can have a poster with a QR code. So a QR code, and I did ask this the other day, I'm not sure if I got a response. So I know in New Zealand and on the east coast of Australia, QR codes are being used a lot for people signing into locations, or so we have a COVID app, for instance, in New Zealand. So everywhere you go, you have to sign in using this COVID app, and you point your phone and you use the QR code. So people are quite used to using it. So it seemed like, you know, and I think in Europe it's being used a lot as well. So the QR code, so you have a poster in the practice that can either be at the top of the device, or it could be placed just anywhere in the practice where people can use their phones. Okay, so that's one way. The other way is that there's a link associated with that QR code, because where the QR code takes you to a website that is specific for that practice. Okay, it's going to ask them exactly the same questions as if they interacted with the device. Okay, so it's going to ask them, you know, please rate the care today type thing, give them the same follow-ups, allow them to put their feedback in on their own phone. Okay, so they're not interacting with another device. So using the QR code, they can do it on their phone. The other way that some of the sites are doing is that you can actually use the link that that QR code sends you to, and you can share that with your with the patients. Generally, you'd want to do this obviously post appointment, and so if that was done either, you know, you could put it on the practice website, you could send it out, you know, through an email if there was any sort of post appointment email, or you know, an SMS. Okay, so all those types of options. If you know, one of the practices like, oh, some of our patients are a bit concerned about giving you know, feedback on the device, those options are available to them. Those results will be just aggregated with the other results they're getting on the device. So we're just trying to give people as many ways that they would feel comfortable giving feedback. Okay, so this can be generated for every practice, and I can show you at the end of this how you can do that for the practice, or the practice can do it themselves. Okay. So, you know, talking to the practice about what makes a successful deployment. So there's really just, I guess, you know, a couple of KPIs that obviously we'd be talking to them about. I talked about the quantity of feedback before. So the more feedback we can get, obviously, the more confident we can be in the results. So I talked about a 20% response rate being, you know, a good target. The two ways I think that you can increase the feedback, and we see this constantly when we talk to different sites, encouraging the staff to ask for feedback. As the last person that sees the patient as they leave, generally it's going to be, you know, at the reception or something like that, just saying, you know, verbally, hey, please give us some feedback on the way out, will improve the response rate quite dramatically. The other way you can do it is, you know, visually. So there's a couple of ways. One, you can just have a bit of information about the device and how it works and that sort of thing, you know, somewhere in the practice, in the waiting room. And I know that Kim had provided a poster on how to use the QR code. So I think that's available if anyone needs that. But the other way that practices can do it is sharing the results. Okay, so the practice is going to get two types of reports sent to them. First one is going to be a management type report that is used for internal. Okay, so that is where they get to see by hour, by day, how they've gone. Okay, and they can perhaps make some changes to the practice based on that. But the other report they will get is a customer interaction report. Okay, the customer interaction report is basically a big smiley face with a satisfaction rating. Okay, so it's not giving too much information away. It's just a really simple report that they can share either by putting it on, the notice board if there's something like that in the waiting room. They could obviously share it socially. So, and it'll be different for every practice, but some practices might be quite open to sharing these types of things socially. We definitely see it in other, other organizations, maybe not so much in GP, but definitely the types of organizations like imaging and physio and that sort of thing. A lot of those types of organizations will share their results socially. So whether that's on things like LinkedIn or Facebook and that sort of thing, or they might just put it on their website. So, just sharing those results with patients says to the patients, hey, thanks for the feedback. We're listening. And, and by the way, we're actually doing quite well. The other, great result is if you make any changes because of the feedback. So if you get a bit of feedback, perhaps some constructive criticism about what's, what you could do better, and you make a change based on the feedback, if you share those changes made with customers, what you'll find is that they'll see that the device is not a black box. I'm giving you feedback. Wow, you've made some changes because of my feedback. I'll keep giving you feedback. So you really want to keep that circle going of people giving you feedback, because obviously they will be seeing a lot of the same people quite consistently. Okay, so that's the amount of feedback. Then obviously you want to be working on improving the patient satisfaction. So again, a couple of ways really the main way you're doing it is just making sure that all of the staff get to see the results. And so a lot of organizations will use that, use the results as part of their, management meeting, whether that's a weekly meeting, that sort of thing. Quick discussion of the results, areas perhaps that, they could do for improvement, the types of things that they can improve. Because what you'll find is a lot of the things that can be improved are often quite small things. And I know there's a million and one things going on in a practice when it comes to health, and especially at the moment with COVID and all sorts of things. But a patient experience is often driven by a lot of things that the people at the front do. So, just having a look at, why we, when we are getting read, which type of follow-ups are we getting, what type of comments are we getting, are there things we can do to improve that? And again, it'll just be a lot of those small things that perhaps the frontline staff can do. So just having the discussion with the practices about, okay, so how are you doing? What's your rating? Are there any days you're not doing as well as others? You will obviously be able to compare an individual practice with some of the other practices that you're working with. And, it may be a discussion about what the good ones are doing, the ones that are scoring high, discussion about what they're doing, and maybe sharing those, those things with some of the other practices, which I'm sure is a natural progression of your type of roles anyway. Placement. So the point of the device, it's designed to be used post-appointment. So, post-experience, okay? So in a perfect world, that would be at the exit of the practice, okay, as people leave the door. Every practice is going to be different. I know there's some practices where that's not, that just doesn't work. Probably the main things you want to think about is, if possible, not having it in the waiting room. In the waiting room, people are waiting, they're bored, they may start interacting with the device before you want them to. And the other one is it's designed for anonymous feedback. So what you don't want is the device facing, for instance, the receptionist, okay? If it is a tight practice and, rooms at a premium, and they do need to have the device near the counter or the reception area, just make sure that it's perhaps faced away from the staff so they can't see what responses people are giving, because you do want honest feedback from people. Okay. So that's sort of everything about the devices.
One second. Sorry, Derek, to interrupt. Someone's popped a question in the chat line. Any suggested strategies on how to get more qualitative feedback?
So I guess really it's just getting those open. Obviously, for us, the qualitative as opposed to the quantitative would be those open comments, those open feedbacks. So the more feedbacks you can, generally the way it works with sites is that of the people that respond to the first question, you will generally get about 50% dropping off. So if we use my example of sort of getting 20% of people to give feedback, generally about 10% will use a follow-up, and then about 5% will give you the open comments. Okay, so so the best way to get people giving those open comments or those qualitative feedback is really just getting more people on the giving the first question response, because you obviously can't skip directly to the qualitative feedback. Okay, and it may just be reminding people. So as part of when you're verbally saying, hey, please give us feedback on the way about, maybe it's just reminding them that there are 3 levels or something like that. So just so they understand that they don't just push the face and walk away. Some people may think that, because some of our other devices that they might see at other locations like IKEA and things like that are a simpler device, which is just pressed face. So it may just be some simple communication to people about, hey, leave us a comment type thing. Hopefully that answered the question.
Thanks,
Anything
Derek.
else? Okay, so I'll talk a bit about the reporting. So the reporting, I guess this shows 2 options. Really, there are 3 ways of getting the results. And so any practice that gets set up, as well as any, I guess, practice support staff, should receive a login to our reporting system, and they should be receiving periodic reports. So it will be weekly and monthly reports based on their level of security. So I guess for the practices, when you can give them confidence that there's no other practices seeing their results. Okay, the system's set up so that's not possible. I'll show you a little bit in a minute. What they may see is they may see how they're doing in comparison to the other sites. Okay, and that's just a comparison. They'll see the other sites will see exactly the same type of thing. They will see how they're doing compared to the other sites, but no one gets to see who's first, who's last, or anything like that. Okay, so but with obviously the practice staff, you may be looking at groupings of practices, so you will get to see your group of practices. Okay, and you'll be able to see how they're doing, between them. Okay, so that's the reports you'll get emailed to you. The other ways you can access the system is logging on to the reporting service just through a browser. So this is browser based. There's no software required to do this. So you can access it from any Google Chrome or anything like that. And then there's also the reporting app on which you could put the app on your phone. So it's a free download on both Google and Apple stores. And it's the same login credentials for you to do that. So you would have been sent, for those that haven't logged in before, you should have been sent an email with your login credentials. If you've lost that or you've forgotten it or anything like that, that can be resent again. Okay. So the first thing you want to do is when you log in, bottom left, there's a My Profile option, and you can change your password from the automatically generated one that we have sent you. Okay. So one of the things you're going to see through both the reports you get sent to you and in the reporting service is what we call a happy index. Okay. So the way the happy index is calculated is it's just a weighted average of the button pushes. So that probably makes it look slightly more complicated than it is, but basically we give the dark greens 100%, the light greens 66%, the pinks 33%, and the dark red 0%. So that is our happy index. That is what we use to compare against other sites, how you compare against different days of the week, that sort of thing as well. Okay, so it means nothing outside of our system, but it's what we use for comparing within our system. So there are 2 screens. When you log into the system, there are 2 screens that you can look at for reporting. Okay, and again, you will be filtered based on your security access. The quick view screen is designed to give you a quick snapshot of how you're going, and when I say your, that would obviously be your part of the business. So you will be able to see your location, and so that may be that group of practices. Okay. If you are able to see more than one practice, then you would be able to drill into the individual practices. Okay. You would be able to see the different questions that you've asked over time, and you would have some options on the time period. You would be able to choose yesterday, today, last week, last month, that type of thing. Okay. And just for your information, the devices will update the results about every 10 minutes. So it's quite close to live. So you can actually see the results coming through the day. Okay. The system's not designed for people to chase people out to practice if they gave a bad response. That's not, you know, what the system's designed for. So that's one of the reasons for that 10-minute delay. It's really designed for aggregated results to see how you're doing, you know, across the days, weeks, that sort of thing. So when you log on to the quick view, one of the things you'll see is the top left, we'll call it key findings. Okay, it's designed to give you how you've gone in plain English. So we'll tell you what your happy index is. We'll tell you how that compares to, you know, the same period last week. So whether you're looking at a day or a week. We'll also tell you if you are able to see multiple locations, what your top location is, and we'll be able to see the best hours and the best days and the worst hours and the worst days. Okay, you'll be able to see exactly how many responses you collected. Okay, so when you're discussing it with one of the sites, just be quite, you know, again, if we're looking at that sort of 20% mark, 120 responses, does that relate roughly to how many people you saw, type thing? You'll then get to see some trends. Okay, so depending on, I'm looking at a single day here, so this is going to be showing me perhaps how I went over a certain amount of periods, but we see some trends over maybe hours or days. You'll also get to see a weekly and a monthly, an hourly and a weekly pattern. The way these work, so this is the last 7 days by the different hours. So what it is I guess another way of talking about it is a heat map. Okay, so this will try to show you, or hopefully it'll visually show you, if there are issues through the day. What is not uncommon at a practice is that you may see that sort of after 3 and 4 o'clock there's a bit more red, and this may just relate purely to the number of people coming through the door after school or at that time of the day. So this will try and show you over the past week, has there been a certain range of hours or a certain time that you're not doing as well as others? Okay, so if you see in a certain time frame that, you know, there's a lot of red in the past 6 days, it may just be a discussion about, okay, well, you know, what's going on here? And often, you know, the practice managers will have a very good idea of what's going on at the time. Yes, we're extra busy, these things are happening, and maybe it's just a discussion about, well, what could we do, you know, to improve that, or maybe bringing something from one of the other practices about, you know, what they're doing. The weekly pattern, so we've got the, you know, the last 6 weeks, and here we have the different days, and this may give us an idea of, are there certain days we're not doing as well? Okay, so we're just trying to visually represent the data to make it nice and simple for people, you know, to consume. Okay, a couple of things you may see on here is you may see, as I mentioned, oh, sorry, just go back one. You may see some comparisons. So as I mentioned, the practices, they won't be able to see how the other locations are doing. They may just see that they are 1 of 10, okay, in your area. Okay, so they would know that they're actually doing quite well, or they might see they're 10 of 10. So again, it's just a comparison to give you a bit of an understanding of how you're doing compared to your, you know, your peers. You'll also see an industry comparison. Now, an industry comparison is based on, I guess, medical practices, which includes more than just GPs, using happy or not throughout the world. So that's quite a big net. So, you know, I would take that with a grain of salt. But again, it's just trying to give people a little bit of an understanding of how they're doing. The analytics screen, it's obviously the same data, and it's really just, you have a few more parameters in here. So in here, you can choose any time period, okay? Whereas on the quick view, it only had certain preset time periods. So with the time periods, you can look at just a couple of days, you can look at a couple of weeks, you can look at an entire year, okay? You can look at 3 years, you can look at as much data as you want. You would have all the questions, you would have the same access to the different locations you had on the other screen. And what we have is just a different way of visualizing the same data. What you'll see in these charts, which is slightly different to the other ones, is you'll see a blue line and you'll see some bars. Okay, the way the bars work is they represent the number of responses that you got in that period. Now, these charts will dynamically change depending on how much data you've selected. In this example, I've selected a single day. So the first chart has dynamically updated to showing me results by hour. If I selected multiple years, the bar chart may be showing me in years or months. Okay, if I was selecting an entire year, it would be months. If I selected a month, it might show me weeks or days. So it'll change, but it'll tell you up here what it's looking at. So the bars represent the number of responses you got, and obviously the colors represent the distribution of the button pushes. Okay, the blue line and sorry, the bars relate to the left-hand axis. So you can see here at that sort of 3 o'clock, I got about 40 responses. When you're in the system, you can hover on the bar and it'll tell you exactly, you know, what makes up that result. The blue line represents the happy index. So that's over here. So that was the one we talked about before, well, I talked about before, where it's the weighted average of the button pushes. So the happy index is over here, and so you can see I'm sitting about 50%, which most of your practices will be much higher than that. We then have the hourly and the weekly distribution. So this is just a different representation of that data we saw on the quick view page, but it's just a different way of looking at it. Okay. So some of the other things that people can do here is they can filter by an individual day of the week. So if they saw that, you know, they're not doing as well on Wednesdays, you can actually filter the results by just looking at Wednesdays for a time period. What you may find is you have a different distribution throughout the day on a Wednesday than you do throughout the rest of the days. Okay, so once people, and you'll find some people, you know, are quite analytical and they want to make this sort of thing. Others, you know, they'll be fine. They'll just receive the reports, but the capability is there to do this sort of thing. So if they find there's certain days of the week they're not doing as well, they can filter on that day of the week and see what's happening. If we add all the Wednesdays together, are we getting a trend occurring throughout the day? Okay. Some of the other things you can do in this area is you can export the results. So while you'll get those weekly and monthly reports, you may want to look at a time period that is 6 weeks or that is 3 months or something like that. So what you can do is you can come in here and you can filter your time period by that, and then you can export those results out to there's different ways of exporting it out. Okay. And you can also drill down in the charts by clicking on them. So if you are looking at a whole, you know, month's worth of data and you can see a specific day that you didn't do so well, if you click on that day, that will actually drill into that day. Okay. So, you know, I've talked a bit about this. This is just another way of showing you. So again, that blue line represents the happy index. What you may see on some of the charts is also a grey line. And you'll see at the bottom of the chart that it will actually show that that relates to the same period last year, last month, last week, depending on what sort of time frame you're looking at. So you will sometimes see another grey line. You may also see, I guess, a purple line. The purple line would actually be the average for the organization. So again, they can just see how they're sitting compared to the organization. Okay. So, and just sort of following on that example I mentioned before about the different days. So in this example here, I can see on the the Saturday and Sunday that my satisfaction is dropping. Okay, so I may want to go and filter on Saturday, for example, and see whether the Saturday distribution is the same as when I'm looking at all the days of the week, because all the days of the week I can see I do quite well. As I get busier, you know, the customer satisfaction drops, which is not unusual. But I'm just wondering whether if I went and look at Saturday, would that be the same? Or is it just that, you know, we have a different crew on Saturday or something like that? So, you know, you may find you get a few more questions than answers with some of the stuff. And so that's where obviously a discussion with the practice comes in about, well, you know, what's happening when we see this type of thing. So that was kind of all I had on the reporting. Were there any questions?
Okay.
Oh, Kara's got a question. Yeah, hi Derek. Thanks for that presentation. I'm just wondering, reporting capability-wise, when we, I guess, analyse the types of questions we're populating each month for our practices, is there the capability to, I guess, assess, you know, if a question has received more response to another to really help us inform what type of questions we use in the future?
So when you're looking at, when you're in the reporting service, when you're looking at the reporting, and I haven't gone in specifically because I didn't want to show any data that I shouldn't, but when you're looking there and one of the filters, if I just go back, one of the filters is the individual questions. Okay, so when you filter on the question, one of the charts below this hourly one is the exact number of responses you got. So if you're looking at the top level, that would obviously be for the entire organization versus if you're looking at individual practices. So that would tell you how many responses you got for that type of question. Just by changing to the next question, you would be able to see how many responses you got for the next question. So, you know, relatively simple to flick between those questions to see, you know, which ones we got more responses for.
And say we wanted to analyse perhaps all of our practices within, you know, like Perth South or one of our PHN areas, can we get a more comprehensive view rather than just our own practices that we're supporting?
So that information is there. That is something, I guess, for the organisation just to provide access to. So we have those groupings in the system, and that data is being aggregated, and you can see that, well, with the right access, you can see that in real time.
Great.
So the capability is there. That's just, I guess, a discussion with Kim or whoever's sort of providing that access, or maybe that's something that, you know, you share as a within the group. I don't know, but yes, the capability is there, and that's already set up.
Okay, thank you.
No problem.
So Derek, going on from that, so I know that I can look at a particular question. So can that then give me, there's two parts to this question. So the first part would be if I went through one question like you've got there and looked across all the practices,
yes,
and I could then gain that information. But I presume then if you then wanted to say, look at all the questions over, say, the last 12 months, you'd have to run a report question by question rather than an overall report. Is that correct?
that is correct. Yeah. So we don't combine results across questions. So you do need to do that individually, and that would just be by changing that filter and then going to the next question.
Thank you for that.
Okay. A couple of things. So there is, so when you log in, there's actually a really good help. So when you log in, bottom left, there's a help site. So when you click on that, it'll take you to a website. There's tutorials, there's frequently asked questions, there's lots of information, as well as we have a handbook. The handbook's sort of more tips and tricks, and it's quite useful to share with a new practice. There's also some communication templates in there, and again, there are tutorials and that sort of thing as well. So the handbook's definitely really good to share with practices before they get, you know, the device, and they can access the help once they have a login. Okay. For support, so you may see some different emails. Whichever one you go with, you will get support. The Happy or Not team, as I mentioned, are based in Finland. So if you send them something, obviously in your morning, you may not get a response for a few hours. So they're on European time, so just an hour ahead of the UK. So they will respond as soon as they start working, but they don't start working probably till your late afternoon. You obviously can access us, and some of that may just be through Kim or someone else coming to us. So either way, you'll get support. If it's a real urgent we're more than happy to take your call. If you're at a practice and the device isn't working, sometimes those types of things can be sorted quite quickly through a phone call, and Kim obviously has my details, so we're more than happy to deal with that as well. And that's that's all I have. Were there any more questions?
Can I just ask one more, Derek? I know that you've really, in terms of when we write the questions and we organise the follow-up questions, and I know you've helped me with that before in terms of how we've set it out. Is there anywhere in the guide there as well that gives you some tricks and tips of how to actually word the follow-up questions? Was
So
that more?
No notes. Maybe not notes so much the follow-up, but I know in the, sorry, just a sec here. In that handbook, there's definitely some ideas on creating questions and what questions are used in certain industries. So as an example, selecting the perfect question, there is just some basic stuff about, what types of things will be useful, commonly used questions, those types of things. So if you're looking for some examples, I'm happy to go and have a look and a chat to some of the other PHNs and that sort of thing. But, there are some examples here. And then I know that some of the sites and PHNs will use the quality accreditation standards as examples of the types of questions they might want to ask as well.
Oh, excellent. Thanks, Derek. I appreciate that.
No problem. Okay. If there's nothing else, if you think of something later, please, more than happy to have that question sent to me in an email, or happy to have a follow-up call. If anyone wants to have a little review of how their group of practices is going and they just want to understand how to analyze the data, I'll be happy to run a session on that with some data that we're confident to show people, just to give them a bit of an idea of how that works as well.
That's great. Any last questions, anyone in the room? Jessica? Look, we're all good.
Okay.
Thanks so much, Derek. Really appreciated that.
No problem.
Yes.
Have a good day, everyone.
Very much. Thank you very much, time. Okay.
Thank
Take
you.
care, everyone.
See you later.
Bye.
Bye.